my name is Lisa. How are you?
Hi.
I'm a nurse practitioner student. Today I'm going to be assessing your head, ears, eyes, nose, and throat. How are you?
Good, how are you?
Good. First I'm going to wash my hands. Can you please tell me your full name?
Michelle Ioria.
How would you prefer to be addressed during this exam?
Michelle Stein.
Okay. And do you know the date?
February 5th, 2016.
And do you know where you are?
My house.
Okay. So I'm going to start the exam. Doing the assessment part, I'm going to be looking at the contour of your skull, okay? Also looking at your skin, noting any lesions, cuts, scrapes, any discoloration. Can I see your hands, please? I'm looking at the color of your skin with this as well. I'm going to be testing your circulation. Nice and brisk. Test this hand, please. Alright. Now I'm going to gently palpate your scalp and your hair. I'm feeling for any bumps. I'm noting the texture of your hair, distribution. Now I'm assessing your scalp, looking for any nevi, which are moles. Does this hurt at all when I touch your scalp?
No.
Okay, good. Can you put your hair behind your ears, please? I'm going to just check the symmetry of your eyes, and along with your ears. Good. Now I'm going to just gently palpate right here. I want you to open and close. I'm noting for any clicking, pops. Any pain with that?
No.
Okay. I want you to clench down. Good. Again. Try to open your jaw. Good. You just tested cranial nerve 5, trigeminal. Next we're going to, I'm going to have you follow a series of commands, okay?
Okay.
Close your eyes really tight. Good. Wrinkle your forehead. Frown. Okay. Smile. Can you try to frown a little more? Okay. Stick out your tongue and puff out your cheeks. Perfect. We tested facial, cranial nerve 7, and cranial nerve 12, hypoglossal. Oh, next I'm going to test for sensation on your face. I need you to close your eyes. Tell me if you feel a hard or soft object.
Hard. Soft.
Good. We just tested cranial nerve 5, trigeminal. Next I'm going to be assessing the strength in your shoulders. This is cranial nerve 11, spinal accessory. I'm going to push down on your shoulders and I want you to fight my resistance. Good. Nice and strong. Alright, next we'll be assessing your eyes. I'm looking at overall characteristics, seeing if there's any redness, abrasions in your eye, any drainage. I don't see anything. I'm also assessing your eyebrows, looking for hair distribution, quality. Good. I'm going to gently palpate. Oh, would you like me to use gloves during this part?
No.
Okay. I'm going to just gently palpate right here by your eyes, the lacrimal sac apparatus. Any pain with that?
No.
Good. I want you...
Rory.
Rory. I'd like you to just look up. I'm going to look at your sclera. White part of your eyes looks great. And look up, please. This is your conjunctiva. It's nice and pink. And I'm just going to look at your iris. Irises on both eyes, nice and brown. All right. Next, we're going to be assessing for visual acuity, cranial nerve 2. Do you wear glasses when you drive?
Yes.
Can you please put them on?
Sure.
This is a pocket eye chart. I'm going to hold this roughly a foot and 14 inches in front of you, and I need you to occlude one eye with your hand. No peeking, please. Can you please read the smallest line possible?
428365.
Great. Can you cover the other eye? Again, please read the smallest line possible.
428365.
Good. Again, we tested cranial nerve 2, visual, optic. That was for visual acuity. And now we're going to test for a couple other things with your eyes. I'm going to test for the reflex in your eyes. Can you please take your glasses off? I want to make sure your pupils constrict and dilate normally, alright? I'm going to look in your eyes with this pen light. Constrict, and that other one constricted as well. Again. Good. When I shine the light in one eye, that's direct, and then the other pupil does a consensual constriction. Now we're going to test for accommodation. So what I want you to do is focus on this object. Then when I say now, you're going to focus on something far off, okay? Focus here. Now. Good. Your pupils dilated as you looked off in the distance. Again here. Constricted and look off. Perfect. All right. We tested cranial nerves 2 and 3, optic and ocular motor. Next we're going to test for the movement in your eyes. So I'm going to have you follow my finger just with your eyes. Please don't move your head. Good. And now I'm going to have you follow my finger again. I'm going to bring it in toward your nose. Perfect. That was convergence. We tested cranial nerves 3, 4, and 6. Ocular motor, trochlear, and abducens. Okay? Next I'm going to assess your peripheral vision. I'm going to be wiggling my fingers like this. I'm going to stand behind you. I want you to say now when you see the wiggling.
Okay.
All right?
No.
Sorry.
No.
Please don't look straight ahead.
No.
Good. We assessed cranial nerves 2, optic, with that, okay? Now I'm actually going to look in your eyes with my ophthalmoscope. I need to dim the lights. Actually, whoa, yeah, do that. Okay. I want you to kind of look just straight ahead, right? This should not hurt at all. I'm looking for your red reflex, which I just saw. I'm bringing my instrument closer to your eye. Just please look straight ahead. I'm looking for the optic disc, noting the margins. They should be sharp. Your macula, arteries, and veins. Everything looks great. Now I'm going to look into your other eye. Moving your red reflex, which I just saw. Now I'm bringing this in closer. You can see your arteries, veins. Nothing looks abnormal. Macula and optic disc with sharp margins. Thank you.
You're welcome.
We're moving on to the ear part of the exam. Alright. I'm going to assess the external part of your ears first. I don't see any obvious redness, swelling, any drainage. I'm palpating your auricles. Do you feel any pain with this?
No, I don't.
I'm going to do some hearing tests. This is called the whispered voice test. Test for cranial nerve 8, vestibulocochlear. I'm going to gently push right here on your ear. I'm going to whisper 3 letters and words, and I want you to tell me what you hear, okay?
Okay. 3, 4, H. 6, 8, L.
Good. Next, we're going to do a couple of tuning fork tests. I'm going to vibrate this tuning fork, place it on top of your head. Tell me if you feel the vibrations in both ears or one ear.
It's in both.
Great. We're going to do the same thing, except the tuning fork will be placed on the bone back behind your ear, which is the mastoid. When you stop hearing the vibrations or the ringing, say now, and I'm going to place it in front of your ear, okay?
No.
Same thing on this side.
No. Yes.
Good. I'm going to actually look into your ear right now, okay? This shouldn't hurt. I'm going to gently pull up on the side of your ear. And right now I don't see any obvious redness or swelling. I'm looking in your ear. I notice some cerumen, which is wax. That is normal. I'm trying to find your tympanic membrane, which I see right now. It's pearly, grayish pink. And
is your cone of light.
I'm going to check the other ear, okay? I don't see any inflammation or redness with this ear. There's some cerumen, not as much as the other ear. Again, I'm looking for tympanic membrane, which I see. There is actually a little bit of redness inside this ear. And I see your cone of light. Do you sometimes stick a Q-tip in your ear?
Yes.
That might be why. Generally, that's not a good idea to do. That actually pushes the wax more into your ear, okay?
Okay.
Otherwise, everything is normal. Do you have any pain in your ears? Okay. Next, we're going to assess your nose. I'm just looking to make sure there's no deviated septum. Looking in your vestibules. I'm going to do a patency of your nostrils test. Please include one nostril, puffed out. No, out. Thank you. Other nostril. Good. I'm using a different speculum. I'm going to look in your nose, okay?
Sure.
Again, this shouldn't hurt. It's pink inside. You can see your turbinates on each side. There's no drainage. Nothing abnormal. Sorry. Oop, I'm sorry. I can see your turbinates in this nose, pink inside, and your nasal passage. Thank you. I'm going to gently palpate your frontal and maxillary sinuses. Tell me if you feel any tenderness or pain.
No. No.
Good. Right. And now I'm going to assess for your sense of smell. I need you to occlude one nostril and close your eyes. Please tell me what you smell.
Alcohol?
Good. Keep your eyes closed.
Oh, sorry.
Again.
Alcohol.
Good. The last part, or two more parts. This next part of the exam, I'm going to be assessing your mouth. So right now I'm looking at your lips, and they look nice pink and moist. There's no cracks, there's no bumps, no lesions. I'm just going to gently lift up. I'm checking your gingiva, which is your gums. Noting for dentition. Any pain when I do this?
No.
Okay. I'm going to have you stick out your tongue, please. Good. I'm going to assess the inside with my pen light. I can see your hard and soft palate. Everything's good in there. This is called a tongue blade. It's going to allow me to see the back of your mouth. When you stick out your tongue, say ah.
Ah.
I'm going to push down a little more. Ah.
Ah.
Good. Sorry. I saw your uvula when it was midline, and it rose when you said ah, which is great. I didn't notice your tonsils, which is perfectly normal. Your pillars were normal as well. Nothing abnormal in your mouth, okay? And now we're going to be doing, with that we assess cranial nerves 9, 10, and 12, which is your vagus, your glossopharyngeal, your vagus is number 10, and your hypoglossal is number 12. For the last part of the exam, I'm going to assess your neck. I'm just going to unzip this a little.
Okay.
Trachea looks midline. Gently palpating your neck area. I'm feeling for your thyroid. Good. Testing for your thyroid, and we've also assessed for your phonation, which is your voice. Everything sounds normal. Alright, I'm going to have you swallow. Good, when I assessed that, your thyroid went up and down, which is perfectly normal. So that concludes our exam. Head, ears, eyes, nose, and throat. Do you have any questions for me?
No, good job.
Thank you.
Thanks.
Bye.